Hi, my name is Kelly Locey, and I'm the Communications Coordinator for the Benton County Health Department. I'm happy to report that today we have no new cases of COVID-19 in Benton County. Our guest today is Corvallis Fire Chief and current Emergency Operations Center Director, Ken McCarthy, and he's going to provide an update on Benton County's Emergency Operations Center.
Good afternoon. I'm Ken McCarthy, the Fire Chief of Corvallis Fire. And for the last 6 weeks, I've also been acting as the EOC Director, or Emergency Operations Center, 50% of the time. Talked earlier in a previous video about what an Emergency Operations Center is, but as a real quick summary, it brings a lot of different groups from Public Works, the Fire Department, the Police Department, outside volunteer agencies, the school district, all together in one room, so we're more responsive and able to act quickly as the needs of a large emergency arise. So I'm going to go back about 5 weeks and talk about what we were walking into as we were establishing the EOC. We'd all heard of the COVID pandemic coming from China and weren't sure exactly how that was going to affect our lives. Quickly in setting up the Emergency Operations Center, we started looking at projections of where this could lead if we lost control of it in the United States. There was always the worst case, the better, and the good case scenarios. Early on, some of the bad cases scenarios showed Benton County requiring 800 hospital beds a week, potential fatalities of 125 people in a week, and many other really scary numbers coming forward. Thanks to quick marketing and education and a very willing public to help through stay home, stay safe, social distancing, and adapting as we were told to wear masks throughout this incident, we've really leveled out that curve. So it's your efforts out there that has allowed us to go beyond those very scary numbers and start working on more narrow-faced responses for our community. So at first, obviously facing those kind of numbers, we had to look at plans that were the best for the most people in the community. How are we going to how are we going to bed 800 people needing hospital beds when the maximum capacity of our hospital is around 280? How do we build alternative care sites in a hurry? Who's going to staff them? Very big scale questions. Now that we've kind of downsized that, we are looking now at particular groups, the houseless environment, who are probably have the greatest exposure to environment and cross-contamination if it were to get into their population. How do we deal with that group? How do we come up with a plan that's best fit for that? So those are the type of issues that we've kind of gone from big scale down to small scale, and we're looking at those. People who have a passion for those different groups feel that there probably wasn't action quick enough. I just asked you to look back to what we have had to come up with in the last 6 weeks. And first issues create second and third level issues. If someone goes to the hospital with COVID who has horses, who's going to take care of their horses? Those are all things that we need to think about. So we've been working very hard to pre-plan those. Public Health has done an amazing job of coming up with some plans that we have now completed. The mass care, the shelter in place, the mass fatality, how we're going to deal with all of those. So as we start to transition forward and looking at how we're going to come out of this, we are starting to change out some of the personnel at the Emergency Operations Center. Not every person who is trained and an expert at handling an emergency have the same skill set going forward for recovery. So we're taking out some of the police and law branch type people and bringing in economic development or economic recovery expertise, the community development personnel, so their expertise can help prepare for the next phase. We will continue to monitor the emergency as this goes along, and as we release some of the restrictions and people are back starting to have a normal life. If there is a spike, we'll be ready to respond back to the emergency side of the EOC. That is one of the nice things about the Emergency Operations Center. It can grow and shrink and change priorities as needed through the process. So it's very adaptable for that. I'd just like to close in saying one of the things I've been telling the EOC throughout this event several times a week is when we do our job right, everybody will say we over-prepared and overreacted to it, but I'll take that all day long versus being told that we were underprepared and how did we get caught with all of these bad things happening without having a plan for them. So I would just like to say thank you again. Continue to participate. I know with the warm weather coming out, it's hard to stay at home, but we just ask, we'll stay at work keeping you safe, ask that you stay at home keeping us safe so we can do our job.